Well, welcome back, everybody, to NeuroDiverse Christian Couples. This is a episode on identity. Stephanie will introduce it later, but we have back with us Dr. Jim Wilder. Jim, thank you for being here.
Say, it's great to be with you, and this
All
should
right,
be
well,
fun.
yeah, so as you know, Jim has been on many times before, and he's certainly no stranger to the show. So to hear more of his background, run through the previous podcast, listen to those with Dr. Wilder. He is, if this is your first time and you're listening at this moment, Dr. Jim Wilder is a neurotheologian. So really quickly and simply put, a neurotheologian is a researcher essentially exploring the intersection of neuroscience and theology. He's got extensive clinical counseling experience. The focus of his catalog of books focuses on relational skills with maturity. And you've probably heard us refer to Dr. Jim Wilder and or the life model many times. We use that material
often, all the time.
His full bio and links to some of his other podcasts and even to his own websites and things like that will be in the show notes. So with all of that said and a couple of tongue slip-ups, Jim, officially welcome to the show.
Thank you. Good to be with you.
Okay, listeners, I want to kind of introduce what we're doing this month. So every once in a while, we'll do a month that spotlights on a certain thing or a certain topic or weaves certain things together. So we did one of those back in June. We started a series that talked about fear bonds with Amy Glazier and ended up with a courses on returning your joy to your marriage. In August, we did a focus on porn and sex addiction and why the neurodivergent brain can be more susceptible to addiction. And this month, we are looking at identity and attachment. So in a moment, Dr. Wilder is going to start us off with identity, the orbital prefrontal cortex, identity formation, and when it goes awry. Then the next week, Barb Grant and I will be talking with Sid and Jeff Holzclaw on your identity and attachment to God. Dr. Gill comes back and chats with just the guys on some kind of attachment basics. Then we have an amazing conversation with Marlene Allen of Life Model Works, weaving in what about adversity, lament, grief, attunement, and its impact on emotional regulation and returning to joy while we pay attention to the very real things that we may be going through and having lament in our life. We'll end the month, but not the series, with Michael Cusick on sacred attachment. We're bringing us back to our identity in Christ. But we'll end the series with Dr. Carl Lehman. We had some neurodivergent listeners ask us to do a deeper dive on their trauma, threats, perceived threats, and attachment pain. And of course, we're going to have him back because we did not finish our conversation in an hour. So right now, here in October, our classes are up and running. We are all full, but we have registration about to open for January of 2026. I mention that because we are putting together a wonderful class based on this man's research. We are combining life passages of men, growing a more human community, the Pandora problem, rare leadership, and solution of choice, which has been quite a curriculum to write. But
So start reading.
cool.
So start reading now.
Right? You need to register now because this is a master class of what we're going to be doing. So with all of that, Jim, will you start us off with kind of developmental psychology, kind of developmental basics, identity? What is it, and how do we form that over our lifespan? And let's start with the healthy best scenario of identity formation.
Oh, yeah. Well, it wouldn't be too surprising to find out that identity is sort of consolidated in the brain as you go along. And so, we have some kind of an eternal identity that operates without the presence of a brain. It's probably starts at conception and goes on, as spirit beings. So how that part develops, we can't really tell, but as your brain learns to be you, it starts before you're born, and all kinds of stuff is starting to grow. But the front part of the brain, because actually the brain grows up, the spinal cord hits the top of your brain, your skull, goes forward, hits the front of your skull, and then wraps around. So it's sort of a wraparound brain that the top's actually at the bottom. The top parts haven't grown yet by the time you're born, and that's simply because of your brain was all there, your mother would never be able to give birth. It'd just be too big. So we're talking about identity centers that aren't formed when we start growing in our identity. So the first part, as Dr. Alan Shore has pointed out, is the growth of our emotional systems. So he talks about affect regulation as being the main dynamic around identity growth. The growth of the self happens with the people that help us feel okay. So it starts out with people who give us the things that we need to eat and drink. It keep us the right temperature. They hold us when we need holding. They change us when we need changing. So it's the care of our physical body that starts growing our identity. The people who are taking care of us, we form attachments to. That is, we start, usually attachment starts with sense of smell. So we like someone who smells like our mother smelled before we were born. And so actually her overall, from what she eats and everything goes through the placenta. Our sense of smell is already working. And so we are born knowing what mommy smells like. And since a lot of that comes from what mommy eats, daddy tends to smell the same way because he's been eating the same stuff she has. So this is that environment in which we begin to grow. So by 3 months of age, we're responding to the faces that are looking at us. By 5 months of age, this virtual interpreter they call the mother core develops in our cingulate cortex, which is what is growing at that point. And we start learning there's a mind behind the faces looking at me, and they're actually thinking things about me. And later on, as we get around 8-9 months of age, the prefrontal cortex starts growing, and then we think, well, when they're looking at me, they're seeing somebody, and who is that somebody? And if they're delighted to be with us, we begin with this sense that we're, really very delightful people to be around. And how all that system runs sort of depends on how the right brain, which is growing first, is doing. If our nervous system is overreactive, we tend to feel like we're getting stimulated too much. If it's underreactive, we tend to feel, like we're left alone in the world. And so the nervous system is now trying to balance itself. How do I deal with the people around me? And the sensory input that's coming in from the world. That's sort of the nonverbal development that goes until about 16, 17 months of age, when the left side of the brain starts doing its growth spurt. And then we learn about language and stuff like that later on, and develop that part of ourselves. So, but most of our identity is already there by the time we're about 18 months old. And from that point on, it just becomes more sophisticated.
Okay, so with all of that happening up until 18 months, a lot of your material kind of talks about these stages of because we know in the wonderful 2s and 3s, that's kind of when we start getting all the no's, because the toddler's like, oh, I'm a separate person from my mom or dad. Let's exercise the power of no or explore the environment. And so
that's
we
actually the growth
that's
the growth of the left brain, who's at this point still disconnected from the right brain. So it grows its own identity, starting by 18 months, going into that 2-year-old. It's thinking it's a different person really than the one that grew the first 18 months. And so, yeah, it acts quite a bit differently and very verbal.
So it's really important then for us as parents not to take that personally then, right?
Oh, yeah.
All of those no's and testing of boundaries.
It's just trying to figure out how this world of words works.
So the first stage you talk about in a lot of your material is, so that's kind of coming online. And then kind of this stage then of right and left brain of like, who am I is first. And then around adolescence, the brain switches to who are my people? Like, where's my herd? Where's my tribe? Where's my community? And so with part of the hormonal and all the things that are changing, the brain kind of does this change from who am I to who am I people. So we talk a little bit about that. We talk a lot on the show about the OFC, or the orbital prefrontal cortex, which was really important to identity. So as the child is figuring out who I am, and the left and right brain are starting to come online and communicate with each other and kind of figure that out. That
The left and right brain kind of happen around age 4. They start connecting and trying to work things out until about 12 or 13, like you say, when the second major change happens. Yeah.
All right. So talk a little bit about that, because um, you stated at the beginning, first of all, we have like an identity that's a spiritual thing that's happening that, we can't track that with, neuroscience. That's a piece of it. But then our brain, the orbital prefrontal cortex, is a key piece of identity. There's all these stages of development that are happening. And I keep saying the word development because autism is a developmental thing. And so that'll kind of come up around later in our discussion. So we have all this stuff going on in the brain. Figuring out who I am. Left and right brain aren't necessarily working in coordination with each other till about age 4. And now there's this deeper who am I, and trying to figure that out. So kind of take us from a little bit from 5 to 13, when I'm kind of establishing who I am and my identity and how I do that. And then what changes in adolescence, where like, nope, okay, I think I've kind of figured out me somewhat or enough. And now I'm looking for my people, my group, my herd, my community.
Yeah, that's it's a new problem for the brain when the left and right hemispheres connect at age 4. It's also the first big apoptotic period where the brain goes through and it gives itself its first haircut, first trimming. The brain actually specializes more by trimming than it does by growing. So at age 4, it goes like, well, what of all these systems in here have I been using? We'll trim out the ones that we're not using, and now we'll just focus on growing the ones that we have been using up until now. So that's a big change. So things like languages, if you want them without an accent, you better learn them before that first trimming happens at age 4, because you might trim out some things you need to pronounce and understand and hear languages. But there's a lot of things that get trimmed then that basically make you sort of like the people you've grown up with. So that's when is it genetic or is it environmental sort of comes together. Like genes gave you lots of opportunities. Environment selected a few of them that said, these are the ones we're going to keep and grow. Then you have to figure out from age 5 to 12 or so, actually, how do I make all of this work together? So it's learning to take care of myself, express myself, understand myself to a certain, important degree. So I kind of know who I am. This is really where identity starts to get firm. Like, okay, I know who I am as an individual. But then how do I make this work with other people? Well, the brain comes back in at age about 13, 12, 13, says, okay, we're going to do another trimming of this. And this time it takes out a lot of the stability circuits. So that up until then, I've been pretty happy to just be myself. Yeah, if I'm a boy who needs girls, if I'm a girl who needs boys, and it says, I need to be part of a group here, somebody who's going to help me get through life. So suddenly the focus of the brain is changed from my own survival at up until about age 12 or 13 to the survival of my identity group. Whoever my herd is, their survival now has become more important to my brain than my own. The problem for, depending on culture and environment, is we might not know who our herd is. The brain has switched over, but now we've got a blank in terms of, well, who is it that's more important than we are? And so that can turn adolescence into a frantic search to try to find my herd, which is who are the people who are like me, who think like me, act like me, care about the same things I do. And we notice adolescence is pretty focused on that, trying to find the people like me. If we're in a healthy multi-generational environment, the people who are like me are actually the people who have the same values I do. if we're in a not so healthy environment, the people who are like me are the ones who have the same problems that I do. And so teenage gangs and uh, even cults tend to gather around the people who share the same fears I do, as opposed to the people who share the same reason for living that I do. So it's very important to see how adolescence going to turn out, to see whether you have a joy-filled and purpose-filled uh, group around you, or if you have a bunch of hurt people around you, because the formation of group identity tends to form more around values when you have a stable value-driven group, and more around fears when you have people who are getting isolated, or who's uh, you know basically still trying to control the things that bother them. And so there's a lot of that still develops, and that process goes on roughly until about age 28 or 30. So trying to figure out who I am and how am I going to make the world work as a participant is the problem to solve later on.
So parents, again, it's a normal stage around adolescence of a little bit of a pulling away from the family. In fact, at this point in time, you are stupid and their 13-year-old friends are smarter than you. So no matter what you say to your 13-year-old, their 13-year-old peers know more than you do. That's a wonderful kind of part of this space. So I think the most important part of being in a healthy intergenerational community, when they do pull away from mom and dad a little bit, there are other healthy people then in that community speaking into their life. Is that another point you're making, Doctor?
Yeah, so your parents can't be your people for your whole life. So there need to be some other people that see value. One of the really important things, though, is that adolescents are trying to figure out what to do with this huge surge in power that's happened in their brains. Their brains now can think abstractly. The hormonal changes and the growth that they're experiencing make them much more intense and powerful human beings. And so they're looking for someone who will give them something important to do and share power with them. And the problem with parents who haven't had for themselves a successful translation into adolescence, that is, they got a lot of opposition at that age, end up being in power and control fights with their adolescents, as opposed to going, here's an environment, we can trust you in the world. We have other people that are going to help you learn to be a powerful person, and we're going to share our power with you. And that really doesn't happen very often in Western societies, especially since basically the industrial age, when families were no longer part of ongoing life. You had to move out of your family entirely and go find a job someplace in an environment where your parents really didn't know anything or didn't have any, influence.
Before we move on, I sense a lot of processing going over here, and I feel like let's go back to is getting ready to come out of your mouth. So what question do you have?
So we don't have to go back to, but I am curious if the date ranges that you gave are relatively constant throughout. I don't know how much history we can know, but have those been relatively constant over the last couple of centuries?
Yeah, they appear to happen pretty reliably across history, going back since the invention of maybe the electric light bulb. It seems like the ages are getting younger. So there's definitely a drift for adolescents to start. It used to be puberty at 16 was not unusual. But yeah, and I'm not saying the electric lights are what happens, but something has happened in our rhythms and some things like that since we've been able to artificially create our own environment that has children now. Starting puberty at 8 is not as unusual. So the ages are drifting younger for puberty. The changes at age 4 haven't changed a whole bunch. But puberty has seemed to move as we've gotten into the modern century or century and a half.
I'm hoping this turns out to be useful later. I'm going to continue this theme.
Okay, let's see.
Does the change in the dates as to when these developmental cycles change, do they move concerted such that do my hormone, let's take the change in puberty time from like 12 to 8, has my brain had enough chronological time to mature at the same rate that my hormonal changes have, or do I now have a much younger brain dealing with hormonal changes instead of a 4-year later brain?
It appears it's a much younger brain dealing with changes that it wasn't ready for. That seems to be the consensus.
I think that's important.
Yeah, I think that's evidence of the world right now.
Yeah.
Right?
The other interesting detail is in the last 100 years, brains are about 8% larger than they were a century ago. So the overall growth of the brain is, and if you go 8%, that is a whole lot more nerve something or another running around than was going on a century ago. So that, is also very peculiar.
So I want to ask some questions if some things kind of go awry or are atypical. So what you've talked about is kind of optimal development, assuming mom and dad, parent, guardian are safe and they're taking care of the baby and the environment is safe and there's resources and kind of everything optimal. But I want to kind of turn it a little bit to what the diagnostic manual does refer to as developmental disorder. Some might prefer to say developmental difference or developmental diversity. But ADHD and autism are in that category of the developmental differences. And it's usually the social relational components that are going to be kind of younger, so to speak. So I'm going to ask about some key components that we know are different in the autistic brain and kind of talk about what could that possibly mean. So you mentioned back at the age 4, the left and right brain kind of trying to figure out how to become one person, essentially. It's kind of acting almost two different people. And what we haven't mentioned yet is with the left and right hemisphere, there is a band of tissue in between called the corpus callosum. So in the autistic brain, we now know through functional MRIs that band is smaller and it's thinner. And sometimes there's not accurate information or not a steady flow of information going across from right to left hemisphere. So what might happen if the corpus callosum is smaller or thinner and there's not the same rate going across as in a typical developing brain?
Yeah, that's, I'll throw in one other detail, and that is that typically the corpus callosum is smaller in males than in females. And a very peculiar bit of evidence is that if you traumatize boys in the first 4 years of life, the damage almost always shows up in the corpus callosum. If you damage girls in the first 4 years of life, the damage tends to show up in whatever was growing at that time, which could be a lot of different systems. But there's this peculiar vulnerability in males to having anything go wrong, makes their brains have difficulty communicating left to right, back and forth. And so if we look at, impose all of that on top of the whatever the factors are with autism, we realize we're going to look at some of the same symptom patterns. And that is, my thinking has very little effect on how I feel. And the problem with thinking that isn't connected with feelings is that the left brain is very good at changing my explanations. So if my explanation doesn't fit, well, I'll just change it. which tends to really annoy people who said, but you said this, or you did that, or you did whatever else. And then this constantly shifting, well, that didn't work, so let me give you a better explanation, which is what your brain is supposed to do. Let's figure out, what's going on. That explanation didn't fit. I'll give you a better one. But when we're talking about things that involves people's identities and emotions, which are supposed to be stable, it makes people feel like I'm just not getting to know you. You're not consistently telling me what you feel or what's going on. And what we're looking at is a sort of a lack of information. In fact, you said you'd have Carl Lehman on. So if you want to have him talk about the verbal logical explainer, which is this function I'm talking about. It's designed to keep improving its explanations if one doesn't work. But that really doesn't feel good when we're trying to get to know somebody. It's like, well, why do you keep changing your story? Or you don't have an explanation, like, I have no idea, which is another response to this disconnected information system. Who I am isn't reaching what I'm saying or talking or thinking about very strongly or clearly. And so it makes my identity actually sound like it's less important to me than it might be emotionally. But words they're not making that connection. I don't know if I've just made things foggier or clearer, but I'll send it back to you.
Do you have a thought about that? Are you processing any of that?
I think that's reasonable. What is, I hope everybody has a visual of the brain in their head, at least a rudimentary.
Google it.
A rudimentary picture of two halves of something, could be nigh unto anything at this point, with a line drawn between them that is moving the data from one side to the other. I hope that is, and I found a bit of explanation of life in some. If the stuff in my feeling side of life isn't crossing my tube over to my thinking side of life, I'm going to not necessarily know how I feel or even interrogate. It also could explain why it takes longer to figure out why I feel or if I feel. It's an extra pile of, well, let's sit here for a minute and go interrogate the other side of my head to figure out if it feels anything.
Yeah. That sounds like maybe the root of another word that's thrown out there in autism land called alexithymia, which simply means the word without the word to describe the feeling, and not being able to. So sometimes a lot in our marriage work that we do, a wife asks the husband, how do you feel? He says, I don't know. She thinks he's being coy or lying or deceptive. And the real answer might be, I don't know.
Yes, that's very likely the case, actually. The connections, when they're weak, are not sending over most of that information. It's it's being processed somewhere else, and particularly unless it's really upsetting, there's no reason for the conscious mind to actually have a notice of it. So usually with this limited communication, you sort of find out what you're feeling when it comes out your mouth or some other form of expression, and you can you sort of observe it externally, like, oh, I must not be yelling unless I was feeling something. And so behavioral expression tends to be actually how the left side of the brain goes, like, well, I observed that must mean something. But it's also sort of unpleasant when your emotions come out before you actually knew they were there.
It's also occurred to me in this conversation that not only is the movement of information restricted by a smaller straw between the two hemispheres, the intensity of feeling could play a role in that. So if I feel not as much, just in general, If
Maybe
I
muted.
if I have a more of a flatline way of the world,
Mm-hmm.
that is going to contribute to the fact that there's just not as much information to move,
Yeah.
and therefore there's not as much to receive. Compare that to someone that has a large straw between the brains and has a much greater amplitude between high and low for feelings, in which case you are going to get a successful communication of that amplitude swing when it's time to express, this is how I feel.
Yeah. I think we could add one more detail, and that is at this 12, 13-year-old apoptotic period, um, there's actually an effect of your attachment style on this. So if you have a dismissive type attachment, which means that your brain has concluded up until now, no one is paying much attention to my feelings. That's what dismissive attachment basically says. This information on my feelings has been sort of overlooked and ignored by the people around me. They're not monitoring it. The brain actually goes through and deletes a lot of the passages that give the lower brain, more limbic system information about how I'm feeling to your cortical system. It's like, well, no one's using this information, so let's just remove these connections, so that someone with a dismissive attachment after age 12 or 13 actually is now internally, even within their right brain, not getting nearly as much information about their feelings. It's like, well, that's not important content for what we have moving forward. So there's a very remarkable adaptation the brain makes to our adaptive, our attachment styles, that further colors this. It's not just across the two sides of the brain, but the deeper brain to the cortical brain also gets a disconnection after age 12, if that information hasn't been getting used much.